Welcome to today's ClinicTracker Community Training Series. My name is Alicia and I'll be taking you through today's topic, which is insurance eligibility verification. Before I get started into today's topic, I do like to remind everybody that these webinars are in fact recorded. And these recordings are made available to you on our previously recorded webinars page. Okay. We have these webinars so that you have frequent access to product experts like myself. We want to make sure that you can make the most out of the ClinicTracker and Billing Tracker system by seeing these scheduled topics and also asking questions at the end related to any ClinicTracker or Billing Tracker question. So as we go through today's topic, I would encourage you to ask questions using the questions panel in the GoToMeeting application. So there's a little area where you can type in your questions. I'll be watching that as we go through. Feel free to enter them in, or you can raise your hand if you're more comfortable having me unmute your microphone and you can speak your question aloud. Okay, so whatever you're more comfortable with, as long as you're asking questions as we go through about today's topic. Or at the end, we're going to open the floor to any ClinicTracker or Billing Tracker related question. Excuse me. As we get started, I just want to remind everybody that your questions, I know I just said it, but your questions are super helpful. So please don't feel bad asking a question. It's certainly something that helps me make sure I'm doing my job well, to give you the information you need about the system. It also helps other people who maybe didn't think of that question but needed that information. So all questions are great questions. Right, so without further ado, we'll dive into today's topic, which again is insurance eligibility verification. Now, the tool that I have up on the screen, I've pulled up a result where the person has covered insurance. So this person is covered by insurance, and you can see all of the services for which this person is covered. Okay, and as I go through, it's, vision, urgent. This is all based on what I requested to see, okay? But let's say that I have a hospital service and I have inpatient co-insurance that I need to be aware of. So you can see here it's a 20% co-insurance for hospital inpatient, okay? Using this tool, you can right-click and then update the insurance demographics individual copay to say 20%. Okay, so that's going to push that information back to this person's demographic record and let them know that every time this person has an appointment, we're expecting every time this person has an inpatient service, we're expecting 20% of that. Okay, and that's because we're out of network. Okay, also on here, you can update the demographics information with notes about this. So now this person's insurance information is all updated with the information I obtained today. Okay, so I'm just going to open up that person's demographic record. On the insurance tab, what you'll see is the individual copay now says 20%, and here's the insurance note. Okay, you're also going to notice that the last requalification date and the next requalification date have been updated. Okay, that's going to tell the system when to recheck eligibility. If I don't want to do it on every appointment, maybe I want to do it once a month. Okay, so now that I've kind of shown you what we can do with this tool, let's talk about how we get in here and how do we use it. Okay, so on a new intake, we can run individual eligibility verifications. Okay, so let's say I put in a new intake. I enter all their information, and I'm just going to pull up a client that I know I have good information for. Okay, so let's say I just entered this client. I saved their record. I can go to the insurance tab, and you'll notice there's a verification button here. Okay, in this tool, I can come in here and press the verify eligibility button. Okay, and then here I can say which coverages I want to look at. Okay, and then I just clicked verify eligibility, and then it opened up his results. Okay, and again, this is the tool we were just looking at, where I can find the coverage. I can look for, here are all the out-of-pockets, or here is everything that says deductible or copay. Okay, so if I'm out of network, I want to make sure I find out of network as opposed to the in-network copay. Okay, and remember, we can right-click here. We can update the demographics. By right-clicking. Okay, I'm going to close out of here. So that's how I can verify eligibility for an individual. Does anybody have questions so far? No questions so far. Okay. In that case, I'll keep going. Okay, now once the intake is entered into the system, you can have this schedule automatically run insurance eligibility checks for your upcoming appointments. Okay, and in a few minutes, we'll talk about how you get into those settings. Okay, but once you have it set up, the schedule is going to automatically check those, and your staff can come to utilities and then insurance eligibility verification review. So this is different than the individual one we just looked at. This is actually going to, show you everybody's verification all together. So I can come in here and say, okay, well, show me all the verification that was run in the last week, or I can limit it for just today. Okay, now you can see there's actually a lot of results in here. So I might want to limit the status and say, well, just show me everybody who's covered. Okay, and here he is. And you can see that in this time, I've run his verification 2 times. So he has 2 records here. On this form, you'll notice that I can right-click the client's name. I can edit comments on here. I can say I reviewed it, I updated things. Okay, I can view the upcoming scheduled appointments if I need to see what this is linked to, or if your process is that you have somebody make notes right on the appointment about what's expected, you can do that here. Okay, you can do the last requalification date manually if you don't have the system set up to do it, or you can navigate anywhere in the system. Okay, it's just a right click on the client's name. Okay, coming down here, again, we talked about this results area. This is where we can see the type of coverage, all kinds of things in here. Don't forget to scroll over so you can see all the messages and details. Okay, remember when you identify the line you want to import, you can update the demographics with the individual copay information right from here so that you're not having to toggle back and forth and manually update things. Okay, this again, it eliminates user error. If there's a typo or something, you could be collecting the wrong amount. So this is a really good tool. So make sure you right click and use this automation. And again, it can update the demographics with notes. It gives all the details about this check. Okay, if you run into non-covered, this is people who the policy maybe is invalid, but you're going to see this information here. Okay. So it was rejected because the patient date of birth doesn't match the patient in the database. So that means that we're not going to be able to submit claims and have them be paid because of this error. So that tells me I'm going to need to go and update this person's demographic information with the correct date of birth or the correct insured information. Any questions on coverage errors or how to read these? Okay, so here's another error. You can see the policy is located, but the coverage is inactive. So that's just telling you that the coverage expired, or maybe they changed employers or something like that, and they no longer have that insurance. Okay, and then if there's an error, okay, we can look at these errors and see if there's anything in here. And you can see this error right here saying the MPI is not valid. And that might be because you didn't enroll with that payer and they request pre-enrollment. If that's the case, you can work with your local system admin or your billing expert internally to get enrolled through the STEM portal. If they have questions about how to do that, they can always reach out and we'll help out with that process. Any questions on this tool for looking at the eligibility verification results that your system runs for you? I don't see any questions, so we'll go ahead and close out of here. And now we'll talk about how to set this tool up. Now I mentioned that it can do a couple of things for you, like check the insurance eligibility based on your scheduled events. So in order to do that, you can come up here to admin config and then options. And then you can come to the administrative settings under admin, okay? Or you can just use the binoculars, whatever you're comfortable with. But under this area, you're gonna see this eligibility configuration button right here that has all kinds of information. So on this form, you're gonna see the days before scheduled event to verify eligibility. So you can see that that's set to 2. It's going to verify 2 days ahead of my scheduled event. Okay, number of days to see if coverage is in effect. So you can check a year out or 35 days out, whatever you're comfortable with. Most payers won't accept 365, but they'll accept like 30 or 45. So be mindful of what you put in there. And then you have the days to retain the data. So this data doesn't really last forever. You need to requalify the patient pretty often. So we get rid of the data every X amount of days, and that X is depending on what you have here. So in my demo system, we hold on to it for 14 days. Okay, here we have only check primary payer events. And then we have bypass patients with future next requalification date. So that's going back to the demographic with that future requalification date. If it's a month out, we're not going to requalify them. Okay, and then we have update last requalification date and next requalification date. So the system can automatically update those dates on the insurance tab that determine if we're going to verify eligibility. So if we bypass the patients with future next requalification dates and the system's automatically updating that date, we're automatically saying, you know, don't check that coverage again for X amount of days. Okay, and then you can choose those default service codes you want to run. Okay, and when you're done, you'll save your changes. Any questions on the setup? Okay, any questions about ClinicTracker or Billing Tracker at all? Hands up, questions in the box. No. Okay. Well, I don't see any questions. So I'd like to remind everybody that we do have these webinars pretty frequently. We do schedule them based on your request. So definitely send your requests in. I know some of you on here, like Amber, you send in requests pretty frequently, which we really, really appreciate. If you do have those requests, please do feel free to send them in and we will get them on your schedule, as Amber can attest to the group for us. We do listen and schedule what you need. So if you need training in a specific area, workflow builder, form builder, report builder, we can certainly get that on the schedule for you. You just let us know. Okay, well, thanks everybody, and I hope you have a wonderful day.